I'm Professor Ahmed Hankir. I'm a consultant psychiatrist, lead psychiatrist for private therapy clinic, and I identify as a wounded healer. So what does that mean? So I'm, as I said, a consultant psychiatrist, mental health care professional, but I'm also a person living with a mental health condition. And that guides and informs my approach to providing care to people living with mental health difficulties. And I would say that my approach is holistic. It integrates different tools, for example, medications, psychotherapy, lifestyle interventions. I don't like to rely too much on psychiatric drugs. Don't get me wrong. I know that for many people, medications can be life-changing, maybe even life-saving, but for other people, it can be life-destroying. So it really does depend on the individual. So my approach is individualistic because it's not a one-size-fits-all, and I want you to be heard, to be seen, to be validated, and to be dignified. Dignity is so important. Also, my approach, I would say, is grounded on a human rights framework, and it's trauma informed. So holistic and grounded on human rights, and as I said, I utilize multiple tools: psychotherapy, pharmacotherapy, lifestyle interventions, and we collaboratively co-create a care plan that honors you and that empowers you. And ultimately the goal is for you to heal and to recover and to be the best version of yourself that you can be. I mean, this is so important because unfortunately far too many people, their trust has been betrayed. That can be from a family member, a friend, a loved one, by mental health care services. And so I have to be mindful of that, and it's a process. And there's no greater privilege, no higher honor than providing care to people living with mental health difficulties, but they are amongst the most vulnerable people in society. So it takes time. It requires care and even caution. Caution in the sense that I have to be extremely careful and mindful that the person receiving care from me can be fragile. They have been traumatized. They are vulnerable. And so that's what I mean by caution. I think we have to pace ourselves. I have to provide them with that sanctuary where they can feel safe. And I have to earn their trust by providing them with that safe space or place. And so we proceed slowly, carefully, gently, compassionately, and with humanity and with humility, and even maybe a degree of vulnerability from my part in my capacity as the provider, as the psychiatrist. I don't often share in a therapeutic clinical context, but sometimes patients, they ask me, and if that helps to build a rapport and facilitate a therapeutic alliance and an authentic connection, and often vulnerability does facilitate an authentic connection, and that can contribute to healing, I do share. I think with human communication, it's one of my favorite quotes ever. One of the biggest problems in human communication is that many of us listen with the intention to respond and not with the intention to understand. And I know what that feels like at the receiving end when I was experiencing a mental health crisis. And my best friend at the time, Dr. Richard Taylor, he would always just bite his tongue. And even though I would at times try to prompt him or goad him into responding, he knew that's not what I needed. He knew that what I needed was to be understood. And so empathic listening is a prerequisite for effective communication. But I mean, it's not just listening, it's also talking. And it's not what you say, it's how you say it. It's the nonverbal communication, the look in your eyes, face, but also, yeah, the language that we use. Because words can be incredibly powerful, words can heal, words can save lives, but words can also harm. So I think we have to calibrate our words carefully. So I went to medical school at the University of Manchester in the UK many moons ago, and I did my postgraduate training. I specialised throughout the UK, Manchester, Leeds, and at the world-renowned Maudsley Hospital, South London and Maudsley, and that included placements rather, in Bethlem Royal Hospital. And I worked in addiction psychiatry. I worked with patients living with personality disorders, common mental disorders, and serious, severe mental illnesses like bipolar affective disorder, schizophrenia, schizoaffective disorder. I also worked in New Zealand as a psychiatry registrar. That was unforgettable. I'll never forget providing care to people from minority backgrounds, so the Maori indigenous people, and working with the Kei Takawenga, which is the cultural worker, a person who is well versed in the culture of the Maori people. And it was really beautiful, and I think that continues to influence my approach. I also worked in Canada for 3 years, and that was invaluable. I worked in the ambulatory care service, so I worked in the urgent consultation service. So I have a lot of experience working globally, and I want to put my experiences, my skills into good use by providing care to people at private therapy clinic. So what usually happens, I introduce myself, I explain what we hope to achieve, I listen to people receiving care from me, I ask them what their hopes and expectations are, because I want to meet your hopes and expectations as best as I can. I make it very clear that my approach is holistic and that I'm there to listen to them, to validate them, to dignify them and to empower them. And then I hand the reins over to the people receiving care from me. I mean, I guide them, and we can navigate their minds together, and we can, towards the end, if the patient meets the diagnostic criteria for a mental health condition, and if they find labels helpful. Not everybody finds a label helpful. Some people do, some people don't. But we can also use diagnoses to, for example, support people receiving care from me at the workplace, because they might be entitled to reasonable accommodations and adjustments, for example. So if they do meet the diagnostic criteria for a mental health condition, then I will let them know. I'll let them know what my clinical impression is, and then we will collaboratively co-create a care plan. So it's a process. I take a full psychiatric history, and we talk about things like, for example, medications that they may have been prescribed in the past, if they find therapy helpful, or if they've never received therapy before. I employ psychotherapeutic techniques in my consultation, and there are different layers to the mind. There can be a neurodiversity layer, for example. There can be an unresolved trauma layer. There can be a mood component. There can be an anxiety layer. There can be an addictions layer. Many layers, and some layers are thicker than others. So that's my approach, generally speaking. But really want to emphasize It's all about the humanity and the humility and empowering patients and dignifying them. The eyes are the windows to a person's soul, right? And I think even just the look in your eyes, right? Like what you communicate, what you convey. And I want patients to know that this is a safe space. That it can be a journey. Just securing this consultation with me, you've had to overcome many barriers. Maybe you're feeling anxious. Maybe you were in denial. And I'm mindful of that. And I understand that you feel vulnerable. But this is a safe space, and I'm not here to judge you. I mean, it's an unforgiving, cruel world that we're living in, and people living with mental health conditions are stigmatized and discriminated against, and you might even be like in survival mode, right? And your defenses are high, and so I'm just mindful of that, and I want to honor you, and I want to listen to you, and I want to make your life easier, and I hope to convey that. I don't know if you can convey that all, through the look in your eyes. Sometimes you actually verbalize that, but I mean this when I say this. Like, there's nothing to be anxious about. Not when you're with us, because everything is confidential, and we are here to embrace you, and to support you, and to contribute to your healing and your recovery. Humanistic, holistic. I integrate the different modalities, tools at our disposal, psychotherapeutic tools, pharmacological tools, empathic, listening, validation, external validation. All of these approaches are the ones that I use when interacting with people receiving care from me, providing them with care. We talk about lifestyle interventions. We talk about social connectivity, spirituality, if you're a spiritual person, what works for you. And I think a very important component to my approach is the synthesis or the creation of a report, because it's so much more than just a report. It's actually a testimony, because your story or account has been tainted by trauma, fragmented. Unfortunately, more often than not, adverse childhood experiences, neglect, abuse, physical, emotional, even sexual, which is horrific. And so what we do is, by generating a report and creating this testimony, I am honoring your voice. And many patients, for the first time, they see this coherent account of what they've been through. And it provides them with closure, with clarity. It can even be therapeutic and cathartic. Just reading the report, you can feel heard and seen, often for the very first time in your life. So that, I would say, is an integral component of my approach. I think there is an over-reliance on medication. I think the threshold for prescribing powerful psychiatric drugs is too low. I think there's a lot we can do before we get our prescription pads out. Not that I'm against the prescribing of medication, because like I said, many patients report that medications are life-changing, life-saving, but also life-destroying as well. Really, it very much depends on the individual and how you metabolize the medication. But I am against the prescribing of powerful psychiatric drugs when it's not necessary, for longer than necessary, and at higher doses than necessary. So often, if the symptoms are like mild to moderate, then we don't need medication. We can make lifestyle changes, for example, or you can receive therapy, for example. But if these symptoms are more severe and are causing considerable distress and dysfunction, I think we have to, at the very least, consider medication. And that doesn't mean that you can't modify your lifestyle or receive therapy. That's all part of a holistic approach. So I think, and plus, if patients are seeking medication themselves, and if there's an indication, then we would certainly consider initiating a patient on psychiatric drugs. How do we tailor treatment to each individual? So it has to be individualistic, because it's not like a one-size-fits-all approach. Like what works for one person may not necessarily work for someone else. Also, what worked for you in the past may not work for you now, and what didn't work for you in the past might work for you now. So we take multiple factors into consideration: any comorbid conditions, physical health problems, your background, your gender, your race, your identity, your preferences, your autonomy, your wishes. We take all of these things into consideration, your family history. There's a genetic component to mental health conditions. And to emphasize, were you prescribed medication in the past, for example? So what worked in the past, it might work again. So that's something that we would also take into consideration. I think increasingly we are seeing patients becoming more aware of unresolved trauma and how it's impacting their lives. And although it might be lurking, languishing in the unconscious mind and you might not be aware of it, it does influence your mental health and your interpersonal relationships and your functioning. It's upsetting. The scale or the magnitude of the problem. Like, how many people have unresolved trauma and they're not even aware of it? And so I would say many of my patients, especially with for example, borderline personality disorder, you don't have to experience trauma, but without exception, every single patient who I have provided care to with a diagnosis of borderline personality disorder has experienced some type of trauma. Neurodiversity, so ADHD and autism, I'm seeing a lot more of those conditions. Common mental disorders, major depressive disorder, generalized anxiety disorder. But also I think people who might feel stuck, I mean, that's a trauma response. So you don't necessarily have to meet the criteria, the diagnostic criteria for a mental health condition. It might just be that you feel stuck and you feel like you are not realizing your potential and you just need that guidance or that advice or the tools to be, like I said, the best version of yourself that you can be. So the areas that I particularly specialize in, I am passionate about the assessment and treatment of trauma-related conditions, complex PTSD. I mean, I would even say that borderline personality disorder or emotionally stable personality disorder, I would say that's a trauma response. I might get some criticism for that. And yeah, the assessment of ADHD in adults, the assessment and treatment of ADHD in adults, and common mental disorders as well. It's on the tip of my tongue, and it's going to, I'll just say it. Some people call it a superpower, living with a mental health condition. And not everyone agrees with that. I think it can be a superpower in the sense that it can make you more insightful. You know, like you've been there, right? I mean, don't get me wrong. Like it's of course it's unique and it's subjective. Everyone's personal experiences, but I think there might be some universality. So if a patient says to me, "I have no hope," I can relate to that. I know how dark and lonely a place the world can be, and so I think that can make me more empathetic, and it informs and it guides my approach. And I feel like there is this like authentic connection because I know what it feels like. I know what it feels like when you are not listened to, or you feel like you are being stigmatized, or you are being stigmatized and invalidated and violated, or maybe even dehumanized. You know, I've been there, right? And I know that you can succumb to despair, and that I know that you can lose all hope. So I'm hoping that I can plant the seeds of hope into your heart, into your mind, into your soul, into your body, and we receive positive feedback. And I think that's the most important thing. It doesn't matter what I think. I think what matters is what the people who receive care from me think. And I'm extremely fortunate because the feedback it makes me emotional because it's very touching, it's very sincere, and so yeah, I like to think that's what makes me I guess, I don't know, unique or different in a positive way. I mean, I've had patients, they say to me that I've changed their lives, that I make the world a better place to live in. Isn't that beautiful? When you receive that feedback, it makes me very emotional just thinking about it. I've had patients when, for example, I left the service, they would cry inconsolably. It's very touching, and it fills my heart with joy. They say that they feel heard, that I capture their experiences, the totality or the entirety of their experiences, that I'm guided by my lived experiences, the empathy and the humanity and the dignity and the humility. So I have received very positive feedback. Fortunately, I mean, you can't please everyone, but certainly for the most part, the feedback has been exceptionally positive. And I think there's the theme would be the empathy and contributing to their healing and their recovery. You remind me of this quote by Carl Jung, and he said, "Show me a sane person and I will cure him." So, I mean, I think there is a difference, isn't there, between, like, I guess a mental disorder, or you have the diagnostic manuals, don't you, like from the World Health Organization, so that's the ICD, or the DSM from the American Psychiatric Association. So, I mean, sure, you can meet the diagnostic criteria for a mental health condition in those manuals, but mental health, and that, I mean, the World Health Organization says, what, 1 in 4 of us at some point experiences a mental health condition in our life? Sure, but you may not meet the diagnostic criteria for a mental health condition, but still you might still be struggling with your mental health. So the point I'm making is, we will see you, we will have a consultation with you at private therapy clinic, irrespective of if you meet the criteria or not. It's all about you, and if you feel like you need that support, that guidance, that assistance, you need validation, dignity, someone to listen to you, then we will hopefully meet your needs. But yes, I would say it's common, for sure, mental health conditions. Even according to the Global Burden of Disease study, I think mental health conditions ranked top of all the health conditions. I think it's inevitable. I mean, disadvantage is not distributed equally, so, might be stating the obvious, but I'll just say it, like, some people, they struggle more than others, of course, but I think it's just part of the human experience. Suffering, difficulty, turmoil, and there's no shame in seeking support for mental health difficulties. Effective treatment is available, and there is no shame in seeking support for mental health difficulties. Seeking support for mental health difficulties is not a sign of weakness, it's a sign of strength, and we really need to rewrite the narrative of what it means to be a strong person. And that's what it means to be a strong person, to embrace vulnerability, to express your emotions, and to seek support. So don't suffer in silence. Don't do that to yourself. Don't punish yourself. Be compassionate to yourself in the same way that you are compassionate to a loved one, or a family member, or a friend. Effective treatment is available. It doesn't have to be this way. Life is for living. I think the common misconceptions, like, there was a study that was conducted, I think like 50% of members of the general public in this study, they reported they would feel uncomfortable sitting next to a psychiatrist in a party, or that we could read their minds, or we are like obsessed with psychiatric drugs, and maybe there's some truth in that. But we do things differently at private therapy clinic. It's not all about the medications. So we have this medical model, the biopsychosocial model, but it should be the biopsychosocial model, but there's like bio, because it's like all medication, and it's not like that with us at all. We are, as I said, holistic, humanistic, trauma-informed, and it's more like psychosocial bio. That's our model. Lifestyle interventions, spirituality, if you're a spiritual person. So Yeah, that's my answer to your question. I think there's no greater privilege and no higher honor than providing care to people living with mental health difficulties. Of course, it's meaningful because mental health conditions can destroy, devastate your life, and you can lose all hope. And it's not just the symptoms, it's the stigma. Many people report, debilitating though the symptoms are, the stigma is far worse. And so when you give a person that safe space, that sanctuary where they can open up and they don't feel judged and they feel safe and they can embrace their vulnerability and they can heal and recover and function, and even, this might sound romantic but it's true, even realize their dreams with the right support, there's nothing more rewarding than that. That's my calling. That's why I love what I do, because I've been there. I know what it's like to lose all hope. I know how dark and lonely a place the world can be, and with the right support I recovered, and there's no reason why other people with mental health difficulties with the right support that we will offer you, hopefully, a private therapy clinic, there's no reason why you can't heal and recover and function and realize your dreams. What do I enjoy doing outside of work? I can spend an entire day just walking around London, UK. I love going to green spaces, parks, lakes, ponds. I love London. I cycle, I run, I raise funds for charities. I spend time with friends and family. I'm a very spiritual person. I love to pray. I go to the mosque. I go to my local mosque. I love to connect with people. I love to learn. I love to grow. I love watching movies. You know, the usual. I don't listen to too much music, but I guess every now and then. And from time to time, I like to dance. Not that I'm any good, but actually, you know what? I like to think I hold my own on the dance floor. With humility. But generally speaking, I try to break it down into its constituent components. And I mentioned this before, like there are different layers when we try to navigate that precarious terrain we call the mind. And you can have like a trauma layer or an unresolved trauma layer. So I break it down. I'm saying, oh, wait a second, let's just focus on this one layer for now. It's a thick layer. There's a lot we have to unpack and go through. And then I focus on the next layer. And it's like they interact. These different layers, they interact and they contribute to your difficulty. So, and I give each layer, if you like, the time, and yeah, I think the right word is respect. You know, you respect the power the mind has over a person, how utterly beholden we are to the power and mercy of our minds. And it's just like that neurodiversity layer might, you know, be the cause of so much misery and distress. So it's really focusing on that and addressing all of the issues. How do I look beyond diagnostic labels? I mean, I just see a human being. It's as simple as that. You are a human being. You have human rights. You have hopes and fears and dreams and vulnerabilities like everyone else. And sure, a diagnostic label, it can be helpful. You can, for example, as I said before, you can have reasonable adjustments and accommodations once you have a formal psychiatric diagnosis from me. But we look beyond that, and it's the human heart, and it's the human mind, and it's the human soul, and it's the human body, and you're just a human being with human rights, and you want to be heard, and you will be heard, and you want to feel alive, and you want to contribute to society, you want to realize your dreams, you want to function, and that's what I see. I mean, I'm not so much guided by my mind as I think I'm more guided by my heart. I mean, I'm guided by both. I mean, because I think the heart and the mind, they are, in a sense, dependent on each other. But I think it's my heart that leads, and when a person's heart leads, they see the human. They see the human in front of them.
Very true. Is there anything else you'd like to tell us?
I think there's no health without mental health. And I think it's something that is often overlooked, and we put it in the back burner, and that can be harmful. I think we need to be proactive rather than reactive. And cliche though it may be, is true, right? Like prevention is better than cure, like prevention is better than intervention. And so you don't have to like wait until something happens. It's like, wait a second, I want to be the best version of myself that I can be. I want to function. I want to live life. I would rather be busy living than busy dying. That's a quote from the Shawshank Redemption, which I love. And it's being on the front foot as opposed to being in the back foot. But don't suffer in silence, because you internalize that stigma. You get the self-stigma and you get the shame, and don't do that to yourself, because life is just too short. Life's too short. Life is for living. So, and it can consume you. Mental health difficulties can rob you. It's like a thief. Like, it takes from you. And effective treatment is available. We need to intervene sooner rather than later, because that's associated with better outcomes. So don't suffer in silence. Living with a mental health condition is nothing to be ashamed about. Be proactive. Don't be reactive. And as I said, prevention is better than cure. Prevention is better than intervention.